Greetings and welcome, everyone. I'm Heidi Mastrud, Director of Alumni Relations for the University of Minnesota School of Public Health. Thanks to all who are joining us live today, as well as to those of you who catch the recording afterwards. In a moment, I'll introduce Dr. Nancy Sherwood, today's presenter. But before we begin, I'd like to share a few updates and housekeeping notes. Our school's experts bring clarity and scientific knowledge to a range of topics critical to understanding and managing the COVID-19 pandemic. We invite you to take a deeper dive into our collection of COVID-19 related science and research stories online. Health in All Matters is a weekly podcast produced by our school to bring more understanding of public health challenges across the globe and close to home. We include expert voices from our faculty and their colleagues around the world. Our premiere series focuses on COVID-19 and the many issues it brings into question, such as transmission and prevention, life in a pandemic, loneliness and mental health, and the medical supply chain. You can find the podcast on our website or subscribe on Apple Podcasts. And since early April, we've put together many webinars on a variety of topics related to COVID-19. You can find past event recordings on our school's website as well. For those of you who are joining us in real time, questions are welcome and you can submit them at any time. Our audience Q&A will be at the end of our time together. Please type your questions by clicking on the Q&A box, not the chat function, on your screen. We'll get to as many questions as time allows. And we'll be recording this webinar and encourage you to rewatch it or share it broadly after the event. The recording will be on the school's website. Today's webinar is one of a series we've pulled together on community health during COVID-19. We are attempting to address how we might understand and promote community health during a time when our normal routines have been upended due to the current pandemic. Luckily, we have the vast expertise of our faculty from the Division of Epidemiology and Community Health within the School of Public Health to help us make sense of it all. Today, I'm thrilled to be joined by Dr. Nancy Sherwood, Associate Professor in the Division of Epidemiology and Community Health. Dr. Sherwood's research focuses on the development and evaluation of behavioral obesity prevention and treatment interventions across the lifespan, with a focus on engaging lower income, ethnically diverse children and their parents. A prominent theme of her work is integrating obesity treatment and prevention interventions into healthcare settings and creating connections between health system and community-based interventions to enhance efficacy and increase the potential for sustainability and dissemination. Additionally, she's interested in newer intervention science methodologies that improve our ability to tailor interventions in order to deliver the right intervention to the right person at the right time. Dr. Sherwood, thanks for spending time with us today. We're really grateful, and I'll turn it over to you. Take it away.
Okay, does that look okay, Heidi?
Sure does. Yep, looks great.
Okay, perfect. All right. Well, thank you so much for inviting me to give this talk, and thanks to everybody for signing on today. Although I always enjoy seeing people when I give a talk, the glass half full perspective is that hopefully more people are able to tune in via Zoom. And that's going to be the theme of my talk today related to eating and activity. How do we take this situation we're in with COVID-19, which has so many challenges, and try to figure out strategies to help us get through the best that we're able to. Obviously, developing and maintaining healthy eating and activity patterns is important for our long-term health. But right now, in this moment, our eating and activity patterns, including physical activity and time we spend with our screens, play a critical role in how we feel day to day, and influence our ability to cope with all the other stressors we are managing. And that's really my focus today. So we know that increased physical activity is associated with more positive mood, that excessive screen time can interfere with our sleep and our mood, and that maintaining a healthy dietary intake pattern also helps us sustain higher energy levels and feel better. But we also know that COVID-19 and all of its direct and ripple effects are influencing these important health behaviors. And what I hope today is that my talk is going to give you some ideas and strategies that you can apply personally, but also that you can think about in whatever work you're doing with patients, with employees, with your own family members too, because I think what I'm talking about is applicable sort of at multiple levels. So what are some of the challenges that COVID-19 has thrown our way? The list is long. This is probably even just a short list of all the challenges we're facing and all the changes. And every individual has some different combination of things. But on that list include financial challenges, job loss, worries about job. Many of us are now working from home. If we have kids, we've become teachers. At the same time, we're trying to do our work. We have challenges with childcare. Along with these things come the fact that even probably more than usual, there's sort of fewer boundaries between work, home, childcare, all of those things that are taking our energy. There's a lot of stress and worry. There's a lot, to some degree, less structure, and lots of sort of room for feelings of boredom, worry, hopelessness, et cetera, and the social isolation that go along with it. Boy, and just this list, I'm going to stop going down the list because it is hard to even to think about all these things. There's also, some changes that are, potentially beneficial. We're spending less time commuting, more time with family, again, which can go both ways. And so, many of these changes that we're experiencing could, like the ones I was just saying, could potentially have positive effects on our diet and activity patterns. For example, we may be doing more cooking at home, eating less pre-prepared foods, et cetera. We might have a more flexible schedule that can allow more time for physical activity in the form of social distancing walks or runs, for example. But it's also highly likely that many of the factors on the list have had a negative influence on our diet and activity patterns. And there's a lot of concern and interest in better understanding what the impact of COVID-19 is on our lifestyle behaviors in the short term and long term, and on our physical and mental health. There's a lot to learn. And many of us are involved in that work. But what I wanted to do is just give you two quick examples of some of the things we know so far. So what this slide, so we know that the economic impact of COVID-19 has been devastating and isn't going away anytime soon. And this slide shows data about how the pandemic appears to be affecting food insecurity. So this slide, what this slide shows is data from a COVID impact survey of mothers of young children that was administered in April of this year. And what it's doing is looking at questions about food, from the USDA Food Insecurity Questionnaire, things about the questions about things like the food we bought just didn't last and we didn't have enough money to get more, examples like that. And what you can see on this slide, what is the the data in responses to the question, the percent saying that food did not last long and there was no resources to purchase more by different types of households. So with the purple ones and where food insecurity, all households compared to households with children under 18, and then households, mothers of children 12 and younger. And then the orange bar represents children themselves talking about food, or the children in the household not getting enough food. And you can see that the black line through the bars represents what the data had looked like in 2018 in response to those same questions and categorized in the same way. And it's really easy to see that, like the rates of this marker of food insecurity are really much higher, at least double, especially in the households with the younger kids. And while so I did want to point this out because this is an important issue. I'm not going to be talking more specifically about food security. We could do a whole seminar on that, and perhaps that is going to come down the road. But before I move on to the rest of the talk, I did want to just include this slide, which people will be able to have access to, which includes some of our local resources, including search for where to find help related to food, what the schools are doing, et cetera. So just some resources for folks. A second study, and this is the last specific study I'll share, is looking at the short-term effects of stay-at-home orders on children's health behaviors. And this study came from Italy. And it's a small and short-term study, but I think it's helpful because it sort of gives some insight into what might be happening on a larger scale. So the goal of the study was to test the hypothesis that that children who are with obesity at a higher weight, what is happening to their lifestyle behaviors during this time when when the children and their families are under stay-at-home orders and not having the structure of school, et cetera. The sample is small. It included 41 children and adolescents who were participating in an ongoing longitudinal study. And they have collected information about diet, activity, sleep behaviors, et cetera, at a baseline time point, and then 3 weeks into the stay-at-home period. So not a long-term study. What they found is that interestingly, their fruit intake increased during the lockdown, which is probably one of the healthier trends here. But then we also see an increased intake of some less healthy food options, sugary drinks, potato chips, an increase in sleep time, which could potentially have positive effects, but a sort of a whopping increase in screen time of almost 5 hours a day. Now, granted, that could be time spent on schoolwork, but that probably only accounts for some of that. And a decreased time spent in sports activities, obviously with constraints on that, or not constraints, just limitations completely. And so I think this gives us a little window into what is happening now for some families and folks, and that we know that if these kinds of behavior changes are sustained over time, that there are negatives in the short term and long term in terms of unhealthy weight gain. But again, that's just a little bit of a snapshot. But if we sort of think about all the different stressors that we're experiencing, a little bit of insight from the research literature that's emerging, some of the core sort of impacts on lifestyle behaviors, healthy eating, physical activity, screen time include, concerns about food scarcity, that there's sort of dysregulated eating and drinking patterns. I didn't show any data on here on changes with respect to alcohol consumption, but there's some hints of that being concerning. The higher levels of screen time and lower levels of physical activity. And with this lack of, differences in the way our time is structured, and, we're really sort of thinking about how do we try to address some of these potential factors in our own lives and also in the lives of people we serve. And even though, these are unprecedented times and they certainly require new ways of being in the world, things like, our social distancing, wearing masks, et cetera. But I do think it is useful to sort of look to some of our tried and true strategies for that can be helpful in sort of in regulating our eating and activity patterns. So this slide shows, so many of you may be very familiar with sort of gold standard kind of behavioral interventions related to weight loss or even dietary and physical activity changes. And I think that there's some strategies we can use from these types of interventions that can be helpful right now. So when we're talking about behavioral interventions for lifestyle change, some of the core factors include identifying, what are behaviors in need of change, what specifically are you trying to focus on, whether it's eating patterns or physical activity and screen time patterns, setting goals for change that are realistic and specific, monitoring progress, how are we doing on those goals over time, and also trying to figure out how do we make changes in our environment that make it basically easier for us to make and sustain our changes. So basically they're trying to make changes in your environment that make the healthy option the default option. And this particular set of strategies, of behavioral strategies, I think is most helpful for thinking about how we can, again, create that structure and daily routines and household patterns to help us with these health behaviors that we're talking about. In a minute, I'm going to talk about sort of another set of tools that may be especially helpful for things like emotional overeating and other kinds of issues. But here, some of the specific strategies and examples could be self-monitoring. For example, when we're focusing on weight loss, we're teaching people about how do you track your portion size and your calorie intake and your physical activity as a way to kind of keep you on track. That's not necessarily what I'm talking about here. That's not necessarily the goal. But how can you think about, with whatever challenges you're dealing with around eating and activity, to try to keep track of what's happening, to know, are you where you want to be, or in what ways do you want to change? So just an example, we right now rely probably even more on things like our smartphones and computers and Zoom for our work, for school, for kids, for school, and for social interactions, et cetera. So I think there is just an inevitable increase. But there are some tools that can be used to even sort of get an understanding of how much you are using, for example, your smartphone, and trying to figure out, like, are there ways that you is it a reasonable amount? Are there ways that you could decrease that amount of time? Are there times of the day when maybe there's other choices that you could make with your time? And I think sometimes just that self-monitoring, using tools like that, can be super helpful. Another type of strategy we talk about is stimulus control, which is basically a more technical way of talking about setting up your home environment to, again, have healthy options be the default options. So this might be, decreasing the availability of less healthy options and increasing the availability of more healthy options. Areas like goal setting, where do you want to make changes? If you assess where things are at with your eating or activity or physical activity, what's realistic? Now is, again, not necessarily the time to set the bar super high, but where's the goal that is going to help you with that, that sort of getting to that level of well-being that's helping you with dealing with the stressors. With setting goals, it's great to set goals, but the fact is that when we set a goal, we don't always reach it. And so the fact that the sort of continuous feedback loop of problem solving to try to figure out how are you doing on whatever area you're working on, what are some strategies that could help you get back on track, what's not working is an important part. Two last pieces here. Of the sort of core behavior change strategies, cognitive behavioral change strategies include just how are we thinking about things, and are we thinking, is our thought patterns being helpful or harmful? And so one example is being able to, right now, we have to be at any time, but especially now, very flexible in our thinking about what's what is a reason, what, for example, is a reasonable standard in terms of eating patterns, activity patterns, et cetera. And how can we, if we aren't doing things perfectly, it's not the time to sort of throw up our hands and say, well, I didn't do it perfectly, but how do you sort of adapt and be more flexible in your thinking? And then lastly, in terms of behavior change strategies, this idea coming from this concept of relapse prevention is, it kind of goes along with the cognitive strategies that if you, are starting your day or your week and things just aren't going the way you planned, then how do you sort of get back on track and not let that, whatever that lapse was, whether it was with eating or not being active or spending too much time on screens, like how do you sort of turn that around and get back on track and being kind of, again, flexible and reasonable with yourself. And then there's another sort of set of tools and that we have used in our work in the context of weight loss. And again, we're not talking about weight loss here. We're just talking about changes or making changes in your eating and activity patterns during this time that are going to be helpful for you. But there's an area from concept of acceptance and commitment therapy, which originally was designed to address problems of more mood and substance use, but has been more recently adapted for the area of diet and physical activity and weight control. And I think some of these approaches can be particularly helpful for addressing problems like emotional overeating, which there's a lot of triggers for that right now, and people vary in the degree to which they're vulnerable for that. But also helpful for, all the sort of standard behavioral strategies can be helpful for sort of setting up plans and guidelines, but at the end of the day, you can have all of those strategies set up, but sort of how do you make yourself do the quote right or healthy thing when you just plain don't want to, when there's things that are going on that are overwhelming. And so a couple of things that I like about the acceptance and commitment kind of approaches, I've put on the slide. So the philosophy in sort of the standard behavioral treatment approaches is more focused on sort of the change what you can piece of things, changing your home environment, et cetera. And that's a part of these acceptance-based approaches. But the important addition is the accept what you can't. Accept what you can't. So the sort of change what you can, accept what you can't approach. And the acceptance part, when we apply it to our health behaviors of eating and activity, and sort of get to the fact that, accepting the fact that there are always going to be feelings, thoughts, cravings, etc., moods that can be barriers to engaging in the healthy behavior, but that sort of adaptive behavior often depends on our ability to sort of tolerate these unpleasant experiences that are barriers and sort of do the healthy behavior anyway. And so some of the concepts and skills from acceptance-based approaches include this concept of willingness. So we're willing, which is about engaging in a valued action while accepting at the same time the discomfort it might generate, whether it's not eating certain foods or going out for a walk when you just might not want to. Concepts of distress tolerance. How do we sort of build up our ability to sort of tolerate discomfort and engage in that valued behavior anyway, even when it's uncomfortable? Another couple more concepts are values clarification, and that's the part about the sort of the commitment part of it, is that in acceptance-based approaches, we spend time talking with people about, sort of what is important to them, what do they want in the long term, and these sort of this exercise of values clarification can help you come up with a reason for what makes it worth it to engage in those behaviors anyway, even when you don't want to. Other concepts to sort of help you do this include things like urge surfing, recognizing that, for example, cravings for food or overeating, you might, that it's not gonna stay that way forever, that you can sort of learn to sort of let that pass, that it's gonna pass and you don't have to act on it and you can tolerate any sort of stress or discomfort. And the idea of diffusion, of that sort of being able to distance yourself from your thoughts and feelings about like what you do or don't want to do, to say, oh, I can hear that voice again of like, I don't want to go outside, and sort of trying to distance yourself from that and sort of do it anyway. So, there's a lot more to acceptance and behavior, acceptance and commitment treatment, but these are just some of the concepts to think about. And they're applicable not just in terms of eating and activity, but in other areas as well. And then just in closing, there's so many different things we could be talking about and so many different tools. But in terms of other tools, I think that we need to be applying right now when we're thinking about just our lives in general, but also our lifestyle behaviors around healthy eating and physical activity. That there's not going to be one size fits all approach for people. That people have to sort of be able to figure out, what's going to work for them, and depending on their circumstance. We also have to recognize that we're going to have to adapt over time. That's inevitable and necessary. So in the beginning of the pandemic, there was sort of a sense of like rules out the window, but what is it like now? What are things going to be like moving forward, and how can we adapt? And then lastly, just trying to remember that, the perfection is not the goal. You don't want to set the bar with everything going on, not setting the bar too high in terms of your eating and activity, etc. But focusing on, again, kind of going back to that concept of the reason to help work on our eating and activity patterns right now is to really help us, with well-being. Well-being's the goal, perfection's not the goal. So I'll stop there, and I think we have a little bit of time for questions.
Yeah, thank you, Dr. Sherwood. We do have a little bit of time if anyone is interested in staying on and asking a question of Dr. Sherwood. You can put that in the Q&A box. I have just one question that came to mind as you were talking. What do you have any reflection on how to help kids through this time? There was a lot of the tools and ideas you were sharing seemed really relevant to an adult mindset, but how do you help a kid urge surf or not let today's overuse of screen turn into tomorrow's? Do you have any thoughts about that?
Yeah, that is a good question, and I think that some of the core tools are definitely applicable in terms of helping, for example, with screen time. I think parents need to sort of maybe make some of the decisions themselves and then try to create that structure for their kids, so it's not up to the kids themselves to be doing that. And I think that some of those strategies of sort of stimulus control, for example, around screen time, in my experience, using tools like the screen time app, for example, on the smartphone, they sort of take some of the arguments out of it. I mean, sometimes that can be a little bit tricky to establish in the beginning, but it can really sort of help. You're helping to the extent that you can help your kids have the healthier option be the default option. I think that's one thing we want to think about, or talking to your kids about the fact that's about sometimes we eat more for more reasons than just because we're hungry, and how are you feeling and sort of what's going on, and waiting till your stomach catches, or your head catches up to your stomach in terms of how full you are.
Fantastic. Well, with that, maybe one other question snuck in. We'll take one more. So Kimberly asks, our daughter is 18 and she made it through high school last year. However, now that she's at home and not at college during the day, she isolates herself quite a bit. I'm not sure that this question is directly about what you've covered, but do you have any thoughts about how to work with a kid in that situation? Is this typical of a teenager, Kimberly asks, and I would, just as a parent of a teenager, I would say it can be.
Yes, that sounds a familiar issue, even sort of sometimes in non-COVID times. And I think it's so hard for everybody, but kids and teenagers in particular, because so much has been sort of taken away. There's no easy answer to that question, but some of the strategies of brainstorming, we can't do these things now. You can't be at school or whatever, but sort of what can you do? How do you want to spend your time? How do you, it's so individual, but I think about strategies, even in my own family, we talk about, we know that it's not good for our moods to just sort of be in the house all day and to not get any physical activity. So how can we sort of figure out how do you, that's something we identify as important, and how do you sort of figure out how you might structure that into your life? How do you, the social connectivity piece, how do you do that? All these things that are having conversations about, well, it is hard right now. What are the things that you can do to kind of try to replace some of the things that are lost, to try to kind of keep, try to deal with some of that social isolation without kind of making it worse with isolating yourself even from your own family.
Excellent. Thank you for that, for those ideas. And thanks for all you shared today, Dr. Sherwood. I found this personally really very helpful information, and I'm sure our participants did as well. Just a reminder to those of you joining us online, the recording will be available, and so you can access that within a day or two. And we hope that you keep your eyes open for other opportunities to learn with the School of Public Health. Thanks, Dr. Sherwood, and to everybody, have a wonderful day.